Hello, everybody. Thank you all for coming to our webinar today, Changing the Game Redux, an updated playbook for e-cigarette regulation at the state and local level. I'm Carrie Cork, a staff attorney at the Public Health Law Center. And as Stephanie said, I'll be your moderator today. As you know, the CDC recently released an annual report finding that youth tobacco use not only continues to be a major public health concern, but that last year during the pandemic, over 2 million middle and high school students used e-cigarettes. Given the lack of strict federal regulation of e-cigarettes, many state and local governments are stepping in to regulate these products themselves. So our webinar today looks at what has happened on the e-cigarette front over the last year. Our session is going to highlight updates to our 2022 Policy Playbook on e-cigarette regulation at the state and local level that was developed by experts at the University of North Carolina and our Public Health Law Center. Our webinar also will look at 4 jurisdictions that have adopted effective e-cigarette regulations and also describe other regulatory options for policymakers and public health professionals to reduce the e-cigarette epidemic, as well as advocacy and education resources for parents, states, and local communities. Before I continue, I need to point out that this webinar is hosted by the Public Health Law Center, our national nonprofit network of legal centers, public health attorneys, and policy analysts that support public health and commercial tobacco control at the local, state, tribal, and federal levels. We do this by providing free legal technical assistance to public health advocates and professionals around the United States in several ways through legal research, policy development, implementation, and defense, a host of publications, all of which are on our website, and trainings such as this one. We don't represent clients in court, and we don't lobby. Finally, our organization is committed to the principle that good health cannot be achieved without addressing health equity. So we have a fabulous lineup of presenters today. Our first presenter is Kurt Ribisal, who is Joanne Earp Distinguished Professor and Chair in the Department of Health Behavior at the University of North Carolina's Gilling School of Global Public Health at Chapel Hill. Kurt is also a program leader for cancer prevention and control at UNC's Limburger Comprehensive Cancer Center. And he has decades of experience in commercial tobacco control. Our second presenter from UNC is Steph Trilling, who's program manager at UNC's Limburger Comprehensive Cancer Center and director of the Vaping Prevention Resource. She's worked for 15 years as a public health practitioner and as a licensed social worker, trainer, and consultant to schools and nonprofits promoting healthy outcome for all youth. Steph and Kurt will talk about UNC's Vaping Prevention Resource and introduce a 2022 updated publication that our project and the Public Health Law Center developed, their project and the Public Health Law Center developed for state and local governments seeking guidelines to regulate e-cigarettes. Second presenters from the Public Health Law Center are Kira Hill and Julie Amajuoyi. They're co-authors of the e-cigarette playbook. Both Kira and Julie provide legal technical assistance to public health professionals and advocates working on commercial tobacco control policies throughout the United States. Kira is an environmental attorney and leads our environmental and climate change team, and Julie leads our national commercial tobacco team and has a strong public interest background as well as a graduate degree in theological ethics. Kira will discuss recent updates we've made to the e-cigarette policy playbook, including changes in federal regulation and related litigation, and Julie will provide overviews of our e-cigarette policy case studies featuring different e-cigarette regulations recently adopted in 4 different jurisdictions. Finally, our last speaker is Meredith Berkman, who is a co-founder of Parents Against Vaping E-Cigarettes, or PAVE. which is an advocacy and education organization created in 2018 by three moms as a grassroots response to the youth vaping epidemic. PAVE is run and powered by volunteers and has become the national parent voice fighting the tobacco industry's predatory behavior towards kids. Meredith, a mother of four, is a graduate of Brown University and the Columbia University Graduate School of Journalism, and she's going to talk about her organization and educational and advocacy resources about e-cigarettes that can help inform and influence state and local policy about these products. So we have quite a few speakers and a lot to cover. I'm going to turn the podium over right now to Kurt. Thank you.
Excellent. Thank you so much. Excellent. You can see the slides now?
Yes.
So I'm thrilled to be here today to have a chance to talk with you a little bit about our vaping prevention resource. And it's just wonderful that we're able to partner with the Public Health Law Center as well as the Parents Against Vaping. So we're really excited about the content that we're going to have here for you today. So we started as a team of three of us, Hannah Prentice-Dunn, who's our project director, Seth Knorr, and myself. We have two researchers and a practitioner who've really tried to pull together and synthesize the information that you need to know to think about how to address the vaping epidemic, how to prevent vaping through a whole series of techniques. And so this is sort of has led to the origin of us forming this particular our particular website. We also have a team of students and staff who are helping us. They're all listed here, and Steph Trilling, who's going to be presenting, is the lead project director on overseeing the website. So, and others here have played a role in helping us pull together both not only the site content, but also the playbook that we're going to be talking about in just a moment. We have been doing a lot of research in tobacco control policy at UNC, as well as on vaping. Here's just a list of 6 grants that we have, but we currently have received over $40 million in funding over the last decade on tobacco control policy. We have 6 R01 grants, which are large NIH, National Institute of Health grants, focused on tobacco control. And we published over 100 articles on vaping over the last decade. And so you can see some of the people here who've been doing work. These are just a couple of selected articles in the last year or two that our team has done. So we're doing work on communication aspects, warning labels. We believe that there's a potential for new and updated warning labels on e-cigarettes. And so we've been developing those. We also look at how to evaluate prevention messages and communication campaigns, as well as looking at the sales and marketing of e-cigarettes at vape shops, as well as other types of retail outlets. So the vision of the vaping prevention resource is really creating a world where vaping is no longer a threat to the health of young people. If you look at the latest data, the rate among high school students is about 13% of high school students are current users, and it's in the 2 to 3% range for adults. So we're seeing, and these rates are down a little bit from what they have been previously, but there's some caveats about that, given they changed the mode of data collection. And so the numbers aren't exactly comparable, but regardless, we still have some major issues to address with vaping. It's the #1 most used tobacco product among youth. And we want to work on empowering communities with both resources and information to help respond to the vaping epidemic. When we created the vaping prevention resource, our primary audience is practitioners. So I'm mainly a researcher, but I talk a lot with people at the local level, the state level, and the federal level. And I was formerly on the Tobacco Products Scientific Advisory Committee, or TPSAC, that guides the FDA Center for Tobacco Products. But I'm really sympathetic to people who are working at the local level and thinking, how do I apply the latest science and what should we be doing to address issues in tobacco control, whether it's cigarettes, little cigars, vaping products, and so forth. So we've really created this site with a focus on helping practitioners sort out what should you do if you're concerned about vaping in your community. A secondary audience are researchers. You'll hear in a moment about the large repository of vaping prevention materials that we've created. Researchers across the country are now starting to use this to study which are the most effective methods. What are the best ways to frame vaping prevention messages? So that is a secondary group, and also policymakers can use the site. And many times the practitioners are working with policymakers, doing policy education and just really educating them about some of the needs that we have. I am now going to turn it over to Steph Trilling, who will tell you specifically about our media gallery.
Great. Thank you so much, Kurt. I'm thrilled to be here today and excited to share with you a couple of the tools that we have available on our website for practitioners. So like Kurt said, we have the largest repository of e-cigarette prevention and cessation messages in the country. Our media gallery, as you can see here, represents 37 organizations and almost 1,000 items, and we're adding to it every day. If you could go to the next slide, Kurt. I'm just going to show you a little bit more about how you can use the media gallery. So you can search or filter the media gallery based on the audience you're hoping to reach. If you want to talk to parents, to young people, if you want to talk to certain demographic groups, you can filter it by language, and you can filter it by message and themes. I want to see what cessation messages are out there. I want to see themes around harms, physical health harms related to vaping. And you can see what other states and jurisdictions and organizations are putting out there and get ideas for your own campaigns, or you can download all of the materials on our website. We have permission to post, and so they're available for free for download. Next slide, Kurt. So this just shows you a little bit more about what it looks like. We also have this tool where you can rate how effective the ads are, which can be a great activity for youth leaders and students that you're working with. Next slide. In addition to the media gallery, we are trying to synthesize what we know about evidence-based practice so that when you are creating your own campaigns or communications messages for young people, you can see what is effective and what we're finding is ineffective or might even be counterproductive. And so this is a tool that you can download off our website. We have interviews with researchers and other information that can be helpful for you as well. And finally, if you go to the next slide, what we're here to talk about today is our Policy Playbook. This is the newest tool on our website and the reason you're all here. So Kurt's going to just share a little bit about the rationale for releasing the second version of the playbook.
Yeah, we have fielded lots of questions from people who have wondered, what should I be doing about vaping? And there has been guidance that has been done for smoking in Surgeon General's reports, and there has been a Surgeon General's report in 2016 that was excellent. I was a contributor to that report and really regularly look at it. But we needed some more updated information and thinking broadly about what should we do. What are the evidence-based policies that are the latest evidence, and what is the state of the art? Also thinking about, with a focus on the local and state level. The federal level, really, which is basically mainly what FDA Center for Tobacco Products is doing, we don't focus as much on that because they have their own whole team, but then providing guidance. And especially as states are thinking through what should we do and how should we adapt? Should we just do the same kinds of things we did for cigarettes and other tobacco products, other combustible products, or should we do things differently? And we also are providing resources for people who, for advocacy, to how to get these policies into place, because it's not enough just to know what works or what should be done or what campaigns are great, but we've got to really put them into practice. So we're very excited in partnering with the Public Health Law Center, and we worked for, I would say, a good 6 months on updating all the information. And we thought we were done last week, and there are some new things on synthetic nicotine that we updated. So good news there. And we're very excited to share it. It's available both on our website as well as on the Public Health Law Center's website. Excellent. So let's see. I will go ahead and stop sharing. So that concludes our slides, and I'm now going to turn it over to our next presenter, Kira Hall. Thank you.
Great, thank you so much, Kurt and Steph. I'm just going to share my screen quickly. All right, can everyone hopefully see my slides? All right, I'm just gonna take that as a yes. So hi everyone. Thank you so much for joining us. As Carrie said at the outset, my name is Kira Hill, and I'm a lead senior staff attorney at the Public Health Law Center. For those of you who attended our webinar when the playbook was first released last year, or you're otherwise familiar with the playbook, you'll probably be relatively familiar with much of the content of the new playbook. But there are also some new elements and changes that we've made, and that's primarily what I'm here to talk about pretty briefly today. So the playbook retains a level-setting introduction with some background information, including information about data related to e-cigarette prevalence, use, and health risks, among other things. It also provides some background about the federal regulatory structure applicable to e-cigarettes. Next, it outlines the basic elements of any policy. The playbook also still retains a discussion of foundational tobacco control policies, a discussion of pricing policies, descriptions of more advanced state and local options, and finally, it concludes with some discussion of possible legal challenges and ongoing litigation. As I mentioned before, there are some pieces in the playbook that are new, and I'm going to talk about those specifically and just highlight what's different and what we've added. And then I'm going to turn the floor over to Julie, my colleague, to talk about another new component that I'm really excited about, which is 4 case studies highlighted in the playbook. So as with the rest of the introduction, the new version of the playbook contains updated statistics and data, as well as a greater focus on health disparities in e-cigarette use and initiation, including data on disparities in use rates among youth, depending on their race or ethnicity, sexual orientation or gender identity, or differing abilities. The playbook also discusses the role of industry advertising and marketing in catapulting youth use rates, as well as the continued existence and proliferation of flavored products. And Carrie mentioned this when she introduced the playbook, but there are several updates at the federal regulatory level that the playbook mentions, and I want to highlight those here. So first, there's an update on the hopefully soon to be released Menthol Rule, which, as you may know, was spurred on by public health litigation led by the African American Tobacco Control Leadership Council against the FDA. The playbook also gives an update on the status of the pre-market review process, which is under FDA's regulatory authority, which at this point has included the marketing authorization of 11 different e-cigarette and heated tobacco products and their components. What it has not included, as you all probably know, is the authorization for sale of any of the most popular products, and therefore most products currently on the market should not be there, as they're not supposed to be sold without an affirmative marketing order from the FDA. The playbook also gives an update on the most recent action taken by Congress to provide the FDA with regulatory authority over synthetic nicotine, which Kurt just referenced, thanks to the advocacy of some of the groups presenting and tuning in at this presentation. And then, as did the earlier version of the playbook, the new version also briefly discusses the role that the FDA has generally in regulating tobacco products. So, and now that includes synthetic nicotine products. And it also highlights the fairly limited action that has been taken to date to limit the availability of these products. So after discussing these mostly ineffective efforts at the federal level, the playbook delves into the role that state and local governments can play in filling that gap. And as I briefly mentioned earlier, the playbook highlights and incorporates 4 case studies on particularly notable local efforts. And I'm not going to go into those now because Julie is going to do that in a bit. But I did just want to highlight that that is really a major component of the new playbook and something that I think adds a lot of value. The playbook section outlining policy basics and key elements will look probably quite similar to the earlier version if you're familiar with it, just given that best practices have remained relatively unchanged since last year. But there are also some new specific policy highlights, including San Diego's minimum pricing policy that we've added. And then, as with the case with the earlier version, the new playbook discusses common tobacco control strategies, including tobacco retail licensing, use restrictions, pricing policies, taxation, as well as other strategies such as sales restrictions. And then one new section that I'm particularly excited about is the addition of a section on e-cigarette waste. Because e-cigarettes contain two types of hazardous waste, both the nicotine and batteries are different types of hazardous waste, and they have become a growing problem for schools and other places that are saddled with hundreds and sometimes thousands of confiscated or discarded e-cigarette devices. We also included a case study on a Boulder County effort to help manage this problem while simultaneously serving an educational and preventative purpose as well. So Julie will talk about that shortly, in addition to the other 3 case studies on other important tobacco control policies. But I did just want to highlight that we have this new specific section as well. And then the new version of the playbook also delves into some of the policy considerations and challenges that jurisdictions may face when undertaking some of the policies discussed in the playbook. So a new aspect of this section is a discussion of litigation brought by school districts, individuals, localities, and states against e-cigarette companies. And most notably, there is currently a large multi-district lawsuit underway that consolidates cases brought by many different plaintiffs all over the US, alleging that Juul misled and misrepresented its products, that they are defective and unreasonably dangerous products, and that they create a public nuisance, among a bunch of other things. Several states have also brought individual lawsuits against Juul and other companies. And 2 of those lawsuits, those brought by North Carolina, the state of North Carolina, and Arizona, have actually settled. So there are a number of provisions in those settlements, but some of them require monetary payments and then restrictions on certain advertising and marketing restrictions as well. And then lastly, the playbook has an updated list of resources related to each of the subject areas outlined. So hopefully that will provide some additional helpful information for those of you kind of looking for additional resources and places where you can find supportive information. Should you have specific questions, the Public Health Law Center is available to help answer them and point you in the right direction in all the ways that Carrie kind of highlighted at the outside of this webinar. So please reach out to us with specific questions. And as I said, that was gonna be quick. So with that, I'm gonna turn it back to Julie to talk about the new case studies that are highlighted in the playbook.
At the beginning, I'm Julia Madri. I'm the lead senior staff attorney for our National Technical Assistance Program. Thanks for joining us on this webinar. So I'll be giving a somewhat of a brief overview of the case studies featured in the updated playbook. So the playbook features 4 case studies that we hope will offer valuable information for communities interested in pursuing various effective policies to reduce youth e-cigarette use. So these are policies that state or local communities across the country adopted to regulate and address the rising use of e-cigarettes among youth. The case studies highlight policies regulating e-cigarette retail density in San Francisco, California. We have a case study on e-cigarette taxes in Anchorage, Alaska. Another on e-cigarette retail licensing in Santa Barbara, California, and a case study on e-cigarette waste in Boulder, Colorado. These case studies were based on numerous interviews with subject matter experts in each of these communities, as well as qualitative research. They illustrate ways in which different communities can overcome obstacles and secure the public support for e-cigarette policies, as well as tactics used in effective implementation and enforcement of these regulations. So just to give an idea of how the case studies are generally structured, we begin with a snapshot of the community. So this includes some facts about the community, such as population size and other interesting facts about the city or county. We also discuss the context for the policy, including the impetus or rationale for the policy. And then we go into depth on the policy itself. What strategies were employed to garner public support for the policies, such as community outreach and education, what kinds of testimony or arguments were presented at any public hearing on the policy, and what the policy itself covers. We also discussed how the policy was implemented and the strategies employed. And where we have the information, we also address the impact of the policy since implementation. And then we conclude with some recommendations. So one of the case studies we highlight is Santa Barbara County's flavored tobacco sales restriction. On December 17, 2019, Santa Barbara County voted to amend the county's tobacco retail licensing ordinance and to prohibit the retail sale of all flavored tobacco products, including e-cigarettes, in all unincorporated areas of the county. The policy was motivated by concerns about the rise in youth use of flavored tobacco products and e-cigarettes. And there was also concern, another impetus for the policy was the fact that one of the largest cities, the largest city in the county, Santa Maria, a relatively conservative community, had already adopted fairly comprehensive regulations prohibiting retailers from selling flavored tobacco products and e-cigarettes. Before the public hearing on the ordinance, the health department spent about 9 months educating the community about vaping and potential local tobacco control policies. Outreach was directed to parents, teachers, and other stakeholders. During the public hearing of the policy, the health department presented information on the prevalence of e-cigarette and flavored tobacco use among youth and the industry's targeted marketing of these products to youth. So stakeholders were vocal in their arguments, both for and against the policy, with shop owners testifying against the ordinance and teachers and health departments testifying for the ordinance. The case study also goes into detail on how the policy was implemented. In the case of Santa Barbara County, retailers were given 3 months to sell out their stock of flavored tobacco products prior to enforcement. So the enforcement began about 3 months after the policy was passed. Some communities allow retailers a longer period of time, like 6 months. But in this case, Santa Barbara, the county decided to give retailers only 3 months, and there are pros and cons to that approach. Another case study we highlight is San Francisco's tobacco and e-cigarette retail density regulation. So San Francisco, so this was the first and perhaps the most comprehensive retail density policy in the US. It involved a 6-year effort by youth advocates concerned about the inequitable distribution of tobacco retail outlets in the city. So the youth advocates utilized what is called the community action model, which is a framework for training advocates to diagnose and research a tobacco control issue in their community and to design policies to address that issue. The youth advocates engage in extensive data collection, organizing, messaging, and negotiations with key stakeholders. So using the community action model process, they mapped tobacco retailers, including the tobacco retailers in the community. They interviewed members of the community, including retailers and policymakers, and they conducted public opinion surveys. The advocates discovered that tobacco retail outlets, stores, bars, restaurants, tobacco shops, and others were inequitably distributed throughout San Francisco. For instance, they noticed differences in the number of tobacco retail stores in low-income neighborhoods compared with higher-income neighborhoods. The county has about 11 supervisorial districts, and the 6 districts with the highest number of tobacco retailers were also the districts with the lowest median household incomes. Based on their mapping of the tobacco retailers in various districts, the youth advocates also discovered that communities of color had access to higher numbers of tobacco retailers than white people, most of whom tended to reside in the lowest density districts. So this is a map here of the tobacco permits per district prior to the implementation of the density policy. You will notice that the inequitable distribution of tobacco retail outlets throughout the city, with some districts having significantly higher retail outlets than other districts. So in sum, their research disclosed that lower income residents, people of color, and young people were disproportionately exposed to the harms associated with tobacco use. So San Francisco made two attempts. There were two attempts to pass a retail density policy. The first attempt failed in part due to failure to obtain the support of the small business community. But the second attempt, which they started in 2011, was successful because after extensive negotiations with the small business community, the advocates were able to obtain the support of key stakeholders, particularly from the business community, who also testified in support of the policy. So on December 16, 2014, the Board of Supervisors unanimously passed a comprehensive tobacco retail density policy that caps the number of tobacco permits in each of the city's 11 districts, supervisory districts, to 45. And they also established other retail location restrictions. So this density policy applies to all tobacco retailers, including vape shops. The policy did contain some exemptions that were included to protect small businesses. And these exemptions made the policy somewhat complex and difficult to both implement and communicate to retailers. However, thus far, the policy has been remarkably successful. As of July 2021, there has been a 30% decrease in the total number of tobacco retail licenses from about 900 permits prior to the policy's implementation to 635 permits. And the districts with the highest number of tobacco retailer licenses before the policy was implemented have seen the greatest declines. Another case study we include in the playbook is Anchorage's taxation of e-cigarettes. On November 4, 2020, the Anchorage Alaska's Assembly unanimously voted to impose a citywide excise tax of 55% of the wholesale price on electronic smoking devices. And the policy was motivated both by concerns about the rising youth e-cigarette use, as well as the fact that the closest neighboring jurisdiction already had a similar policy in place, alleviating concerns by policymakers that users could simply obtain these products from a close neighboring jurisdiction. So with one of the strongest and most well-funded tobacco control prevention programs in the country, there were already educational campaigns at both the state and local levels that helped educate policymakers and stakeholders on the prevalence and health harms of youth e-cigarette use. The fact that the city, Anchorage, had already recently passed the T21 policy also helped pave the way for the e-cigarette tax policy. And we know that price increases are one of the most effective ways to reduce tobacco initiation and encourage cessation, especially among price-sensitive youth. So as with the other case studies, there were public hearings on this policy, and arguments were raised both for and against the policy. Vape shops and e-cigarette retailers, argued against the policy, and advocates, public health advocates, argued in favor of the policy and emphasized that the policy was not intended to target adult users, but to prevent underage use. And this argument was particularly persuasive to the assembly members. So the final ordinance passed by the assembly applied the city's existing excise tax on other tobacco products, which is 55% of the wholesale cost, to e-cigarettes. So the tax would cover the device, any liquids or substances used in the devices, and components, parts, and accessories of the device, excluding batteries or battery chargers. And it also excluded devices sold in marijuana establishments. The policy's implementation was relatively simple and smooth since the city already had an existing excise tax policy on other tobacco products, and e-cigarettes were simply incorporated into the existing framework. The final case study that that I want to highlight is the Border County's Tobacco Product Waste Collection and Education campaign. In 2017, and both the county of the state of the Colorado as well as the county, Border County, have historically had one of the highest vaping rates in the country. And in 2017, to combat the high youth vaping rates, the Border County's Public Health Department and the Resource Conservation Division formed a partnership to properly collect and dispose of vaping products in schools throughout the county. As I already mentioned, this was motivated both by public health concerns, but also by environmental concerns involved in the accumulation of e-cigarettes in schools, as well as fires caused by e-cigarette batteries. So the county's tobacco prevention staff and the hazardous materials staff collaborated to develop what they call the Vape Aware campaign. The campaign was developed to promote awareness about the health and safety risks associated with e-cigarettes and to share guidance and tools for proper disposal of these products. It was a program, and it also, another motivation of the goal of the program was to engage students and teachers on the significant negative environmental impact of these products. And young people were particularly persuaded by these environmental concerns. I think that's all I'll say for the case studies. For more in-depth information on these case studies, any of these case studies, and the strategies employed by these communities, please see the case studies. There are links to these case studies both in the playbook themselves, and these are posted both on PHLC's website and the vaping prevention resource website. I'm going to stop sharing now. And with that, I'll turn this over to Meredith.
Thank you so much. My name is Meredith Berkman, and I am a co-founder of Parents Against Vaping E-Cigarettes, or PAVE. I suppose I'm going last because in some ways what we represent is the real world consumers, the people for whom this playbook is so important and so vital. And frankly, when we started our group in 2018, not knowing any of you and not knowing any of this, I only wish we had found the original playbook because it would have probably saved us a lot of time on our learning curve. But we could go to the next slide. Thanks. So our group of parents started in 2018, and I'll just read this quickly and hopefully briefly tell you our origin story because I think it's relevant to this conversation. And again, I first want to say, or I should have said first, that I'm so thrilled to be included today and to be presenting with our wonderful partners, both at the Public Health Law Center and in North Carolina at Viper. So thank you. So PAVE is a national advocacy and education nonprofit powered by parent volunteers. I'm a full-time volunteer, as is my co-founder, Dorian Furman, who's in this photo. You can see her over my left shoulder, and our founding partner, Mimi Boblik. And we're fighting the youth vaping epidemic and the predatory practices of big tobacco. What we support is ending the sale of all flavored tobacco products. That would be all flavored e-cigarettes, all menthol, and all other flavored tobacco products. And our origin story, to cut it very short, is this. In April of 2018, my then 16-year-old son came home from school and told me and my husband that he wanted to tell us what had happened at school that day. And as a parent of 4 teens, I never hear, I want to tell you what happened at school that day. So we were all ears. And he proceeded to talk to us about what he referred to as a, quote, mixed message anti-addiction talk about Juul at school before a 9th grade assembly, at which teachers and administrators had left the room, which was common for one of these outside talks. And as this supposed educator talked to the kids about Juul, which at that time, all of the kids in the room, many of them who were already juuling, knew what that was I, as a parent, really had no idea what a Juul was nor what e-cigarettes were. But every time that this adult said, Juul is for adults, not for kids, he followed up his statement by saying, but it's, quote, totally safe. He told them again, repeatedly, it's not for you, it's for adults, and it's, quote, 99.9% safer than combustible cigarettes. He also told them it would be receiving FDA approval, quote, any day. Something that we still are waiting to hear about. At the end, my son, being a skeptic with Dorian's son, Philip, went up to this man and asked more questions, at which point he took out his Juul. He showed the two teenagers how it worked and referred to it as the iPhone of vapes. Within 24 hours, what we learned was that, in fact, this was a Juul representative, that the school had no idea, and that he had been brought in through what we assume was the absurd naivete and potentially the good intentions of this outside group. As we started late at night over the next week or so, my two co-founders and I, to research, we were horrified and shocked to discover not only the scope of the duplicity of this company, Juul, but also the scope of this issue that wouldn't be referred to for many more months until later that year as the youth vaping epidemic. And so this was our wake-up call, and we knew we had to do something. And here we are, you know, in a very short time, we grabbed our sons, we went to Washington, and we shared that story I just shared with you with any policy maker who would listen, knowing that we would never share it publicly until the right moment. Instinctively, we found an email that was written the day after that incident, at which we said to each other, we're going to testify about this in Congress. We're going to have an impact on that company. And that happened later in July of 2019. So we go to the next slide. That's me testifying. So we started as an advocacy organization, and what we do is help pass laws across the country at the very local level, at the city level, at the state level. And of course, we're also fighting to advocate at the federal level. I mean, I think you can see, just for example, that, you know, I'm the one in the Pepto-Bismol pink dress around the White House conference room table with then President Trump and many of our partners and the heads of some of the tobacco companies talking about, you know, this was like the vaping summit. You can see in Chicago, in Los Angeles, in New York, many other places. And we started as advocates because we knew instinctively, again, had we only had the playbook, that you have to change the laws to protect kids from the predatory behavior of the tobacco industry. And we also, ultimately, we also started our education initiative. So we're both an advocacy C4 and a C3. And what we do is provide free education and training for parents and for practitioners, anyone who wants to be trained to go out and educate others in their own communities about the dangers of youth tobacco use and about, again, the predatory behavior of these companies. We could go to the next slide. This is just from, for example, from our basic parent presentation, which we used to do in person, but now we do on webinars. And actually, this is just, you know, very basic. It talks about youth vaping in 2021, making the point that, as Carrie said at the beginning, that we know that the latest federal figures showed that 2.2 million teens are vaping, which I think it even says in the policy playbook that I think many of us fear is low because this was the first year when the methodology was changed. And so what we see and hear from so many of you, I think, who are probably listening, all of our partners at the local and state level, is that this is not an adolescent public health crisis that is diminishing or has passed. In fact, the elevation of anxiety, particularly now when we're in the midst of an adolescent mental health crisis, coupled with the return to in-person learning, has really created a perfect storm. But this is the kind of education slide, we can go to the next one, that we will give. And for example, last night was the first of a series of three webinars that we're giving in Nevada with public health department in Washoe County. And actually for us, it was very exciting. It was the first time that we simultaneously were presenting to parents in English, also in ASL, and also with the breakout room in Spanish at the same time. So we were really thrilled to do that. And again, our goal is to provide in Spanish and in English free educational materials. And again, as I said, we work with many different public health groups and public health departments around the country, because in some ways we feel that education is the most important form of advocacy. And again, here, 2022, still waiting for regulatory action, again, from our basic presentation, and it references some of the things that you've heard about and that, of course, are in the playbook. The rise in, the huge rise in disposables. I mean, think about this, up to 10 million disposable e-cigarettes. 10 million per month only. That's only from convenience stores. We know that over the last school year, vape detector sales have increased, I think, 400% over last year. And of course, we know, and again, you can read about in the policy playbook, about all of the litigation. I mean, school districts are not naturally litigious, but these school districts and educators have been harmed as the students have been harmed. And so again, this is also something really important to think about. And we could go to the next slide. So again, why are these still available to our kids? This is what we're all about. I mean, we are the first national parent voice in the fight against big tobacco. And what we say to parents and to educators and to prevention specialists and public health groups and public health professionals who reach out to us from all over the country is that we are in this fight with all of you, all of our partners, to both amplify the heavy lifting that so many of you and so many of our partners have done for years to protect children and other priority populations from the tobacco industry. So we want to amplify the message. And we are living it in real time on the ground. And we think that our voice, the parent voice, can really, we hope, and we believe it will continue to make a difference. So here is one of our education slides. Why are these still available to our kids? Well, that's a really good question, right? FDA failed to fully regulate these products for years. And to be clear, the core of our advocacy is about flavored products, not about tobacco flavor, just about, with the exception of tobacco flavored Juul, which we're very clear, given our own experience with that company and the experience of so many, we do not believe that they are deserving of any kind of FDA approval. But with the exception of tobacco flavored Juul, we're just talking about flavors, in particular menthol, which we know has now become one of the most, among the most popular flavors for youth. And because we're on the ground living it in real time, we know, for example, that we're very concerned about the rise of the so-called iced flavors, which are mentholated flavors. So in fact, the use of menthol e-cigarettes may be much higher than the research shows, because it won't be until at least 2023 that the National Youth Tobacco Survey and the YRBS surveys actually ask kids, do you use iced flavors? And synthetic nicotine Again, we were very, very happy that just in the last few weeks, synthetic nicotine products will now fall under the purview of FDA. And that's extremely important, particularly because the most popular brand among kids, one that has been warned many times before, we and many others have been going after Puff Bar because of their very predatory behavior towards kids. Puff Bar had claimed its use of synthetic nicotine. So we're really happy to see that hopefully there'll be enforcement from FDA on that. These things obviously move too slowly from our perspective, and probably for many others would agree, but we don't have a lot of time to make sure that this does not become an entire generation of kids who are the next generation of tobacco's lifetime customers. And we could go to the next slide. Thanks. One other thing that we're thinking about is the proliferation of non-nicotine vapes. These are being marketed to youth. You can look at some of those pictures. They look like the age of some of my teenagers. These are in a regulatory gray zone, but they contain flavors. They contain propylene glycol, PGVG, just as the nicotine vapes do. And they are incredibly accessible. For example, they are sold over the counter at Urban Outfitters. Let me just repeat that, over the counter at Urban Outfitters to kids, and they're making very much unsubstantiated health claims. Again, these are non-nicotine vapes. Obviously, they don't fall under the Tobacco Control Act, and I'm not suggesting that they should. But what I am suggesting is that there is emerging research that lots of younger adolescents are using these, and the fear is that they're not regulated. They're sucking these same chemicals, some of the same chemicals, deep into their developing lungs, and no one is regulating that. So that's something that we're concerned about. And we can go to the next slide. And this is a lot of what we do. And this is in some ways, I think, the most important, which is parents will ask us, what are the signs that my child is vaping? And so we provide, and again, in some ways, I always, when I look at this, I'm bemused because I wish we created this in partnership. Everything that we do, frankly, is in partnership with medical professionals. You know, we only speak to parents, not to kids, because we don't have that training. But what I like to say, well, I do have a PhD in parenting. I have 4 kids, and I think that's worth something. And so, you know, the secretive attitude, the closed door, the sweet smell. My own son asked for an incense burner, and I thought, oh, he's so spiritual, right? You know, the dry mucous membranes, the colorful caps. So we can go to the next slide. I think many of you will understand what I'm getting at. Changes in sleeping patterns, heightened caffeine sensitivity, terrible mood swings, getting Nick sick, gastrointestinal issues, unknown or increased spending or deliveries. I mean, we have had, from the day we launched our website, our original goal was to just have a parent education website for people like us who didn't even know what was happening. But from the day we launched our website, I think it was like the first day of school in September of 2018, we just have had parents from all over the country reaching out to us over and over and over. And what I say to people is that the stories are both unique to that family, to those parents, to that young person, but they're also uniquely universal. Because the most painful thing out of all of this, and I think we all know it, is that this was a generation that would otherwise not have been initiated into tobacco use, but for the entrance onto the scene in 2016 of Juul. And of course, we focus on Juul because Juul opened this Pandora's box, and so many others, so many bad actors have followed, including Puff Bar and Miley and so many. But we know that, again, the youth smoking rates were so low, single digits, that this is in some ways the greatest tragedy. This is not a generation of kids that would have been using tobacco, which is why it's so important that we fight as hard and as quickly as we can. We could go to the next slide. I hope that some of you or all of you would be able to attend our Clear the Vapor conference. This is our second annual conference. It's all free and virtual, all virtual, because we want to make sure that any parent in America or any guardian or any prevention specialist who works with parents or anyone in this space who is anywhere is able to attend. And the goal, our last year for our inaugural conference, the goal was to have extremely high level information providing the latest research and resources, like the Policy Playbook, for example, but in a highly accessible way. And so what we did then and what we will do again this year is these conversations, they're intended as conversations that provide information, and they're moderated by our parent volunteers from across the country, asking the questions that people who are living this, parents, families, and others really want to know. So I hope you'll join us. We'll be sending out information, and you can find the information about the conference where we'll be looking at best practice for schools. We'll be looking at new products, new health harm research, how to get started with local advocacy, et cetera. It's May 24th and 25th. And again, it's all free. And I hope you'll join us and spread the word. We could go to the next slide. Oh, sorry. And here you can scan. I don't know how to do that. My kids do, but if you scan there, you'll get the information to pre-register. Again, we really hope that you'll help us spread the word, and even better yet, you'll join us. And I think maybe this is our last slide. Which is, actually, I was really interested as I had been reading this in advance and then listening to the great speakers. I was thinking about this during the Boulder case study. We actually, because so many parents, write to us, desperate because their kids are suffering from seizures or their kids are suffering from severe asthma. By the way, all of these things, for example, the seizures, though FDA had said there was no direct link when they looked into that, we continue to hear from families whose kids have had seizures. And the Ebola epidemic also continuing, not being recorded by CDC on a weekly basis, but dozens and dozens and dozens of cases that you can find if you go look in the media. And then there are just the parents whose kids are addicted. And when the kids are told it's, nicotine, it's bad for your developing lungs and bad for your brain, we know, because we have kids ourselves who have used these products, they hear this, like in the Charlie Brown cartoons, won't. And so we realized that what we wanted to create was a program that could be used in multiple cities and states and at all levels that would engage teens, just as in the Boulder example. And so we created a program called Vapes or Trash. And we are very grateful to have had help on working on this with people, including our partners at the Public Health Law Center, and others, Professor Jeremiah Mock and many others. And really this was created by teens, for teens, looking at the environmental impacts, because we do of e-cigarettes and the tobacco industry, and we actually just now are working with one city public health department in creating a sort of a specific social media campaign for them. And we'd be very happy to talk to others about using it. But this is a way to engage teens about a very real problem. Maybe there's one more slide for which I apologize. And then I'm going to, again, PAVE is made up of volunteers across the country. We ask people always for feedback, and we would love to be helpful to any and all who are on this call who are looking to educate parents or train parents or want us to help them reach parents, because as I said, that is what we do. It is the first national parent voice, and our goal as parents is to advocate and educate and empower parents to fight back to protect our kids, which is all any of us want to do, is to protect the vulnerable from the tobacco industry. So I think with that, I do think that's the last slide. Oh, it's not, sorry. You can please follow us. We get a lot of hate on Twitter. I'm sure many people on this call do. And we have a podcast, Big Tobacco Mess with the Wrong Moms. But now I am very happy to toss this back to our wonderful MC, Carrie. And again, thank you so much to our partners on the Public Health Law Center and to our partners at UNC at Viper for having us. And I hope to continue the fight with all of you.
Thank you, Meredith, and thank you all for presenting. We have about 15 minutes now for questions from you, and I've got a few right now. I know that as their presentations have been going on, people have been sending us questions, and several of them have been already answered. But I'm going to start first by pointing out again that this webinar is recorded, and we'll have the slides available shortly. And we also applied for CLE credits for those of you who are interested. The first question that we received is, I'm going to ask Kira because it has to do with the FDA. And the individual wanted to know if there was any knowledge or push and asked, is it even realistic for the FDA to enact a nicotine content limit product standard?
So I think there are two questions there. One, or kind of aspects to an answer, maybe. One is whether or not the FDA has authority to do that, and then two is whether it will or would. In terms of whether or not it has authority, you'll see in the playbook, we outline the tobacco product standard regulatory authority that FDA has. It would have authority to impose some sort of nicotine content standard, but whether or not it will or wants to, that's, I think, sort of like a political question, and I don't really know the answer to it. I did look up the Unified Regulatory Agenda, which is a list of basically, priorities that the agency has for upcoming rulemakings, and there isn't anything along those lines on that Unified Regulatory Agenda. That certainly doesn't mean that it's not being worked on, but it probably means that it's not super high on the priority list. So hopefully that answers the question, but feel free to follow up if there are lingering aspects.
Thanks, Kira. Now I'm going to open this up to anybody. Please share recommendations for which stakeholders to involve in initial tobacco policy discussions, specifically within rural areas. Okay.
I generally, you want to sort of invite, those who have policy. I know, for instance, in the Santa Barbara retail licensing policy, and it also depends on the policy too. Outreach was made to both teachers, parents, retailers, pediatricians, essentially those who have an interest in, who have a stake in the issue. So I guess that at the most general level, that would be, certainly retailers, if retailers be impacted by the policy, parents, teachers, youth, young people. So as many voices as you could bring in, and that's, that would be ideal.
I'll also add, we do a fair amount of work in rural communities or with rural communities in California, and there's a group there, Rise, that is worth connecting with if you're kind of interested in how to organize and work in rural communities. And definitely what Julie just said and highlight the youth piece of it, I think is important.
I don't think anyone will be surprised when I say parents, obviously, because we do work with parents in all communities and across all populations. And I think, again, I think that the parent voice can be very important and very effective. And remember, when you're talking about children, parents and guardians of children who are impacted, then you're putting a human face on a public health issue. And I think that has really can have sometimes the greatest impact, we hope, on policymakers, because we're talking about people, the people who are truly being impacted. I mean, that's what we, the storytelling aspect of what we do when we have families who are willing to share what, I mean, frankly, I had no idea just sort of the shame and taboo around addiction, even this kind of addiction. It's so painful for families, but I think reaching out to parents, and that's something that we take very seriously, the responsibility of protecting people who are in pain. But if you can access parents and certainly anyone who is interested, as I said, we have done work in lots of different communities, and we're always happy to help people reach the parent voice. So I would say that all of the voices matter, all of the stakeholders matter, but in some ways what we're talking about is impacted kids and their families.
Thank you, Meredith. Here's another question. Is the tobacco industry evading flavor bans by using concept flavors like jazz or colors, blue, instead of explicit fruit flavor names? What can be done to get the FDA to update the characterizing flavors definition, especially since most enforcement action depends on descriptions on the package? Can FDA require chemical analysis?
Can I just jump in, and then I'll let the experts on the regulatory and the legal piece. I made a reference to iced flavors. And one of our great frustrations, and I'm sure for all of us, is how long things take with the federal government. That's just the nature of the beast. It doesn't mean that people don't care as much as we do about protecting kids at FDA, but it's just taking too long. And we have raised this issue with people who have the power, to have an impact on this, about iced flavors. Again, iced flavors and concept flavors, this iced idea, an iced raspberry, an iced mint. I mean, I've seen iced mint, that's like menthol mint. These are mentholated flavors, but the problem is that the questions are written so far in advance. And so again, we won't be able to get those answers till 2023, but I think it is a really important issue. I'll let others speak to the regulatory and the legal piece, but it is really a problem. We know that they're shape shifting so fast, which means we have to keep shape shifting and fighting them every step of the way.
There's a question, how can we move forward these efforts in an environment where the political ideology rejects federal requirements and rules and is dismantling regulations at the state level while preempting local work, particularly when constituent pressure does little to help sway policymakers? Yeah, we definitely, before COVID, during COVID, there's been such a sort of an anti-science sentiment, and it's just been very, very challenging. Even in the face of it, common sense things like getting the synthetic nicotine regulation was able to get in. FDA is still intends to pursue the menthol piece. So there are still some things happening. I do think our climb is a little more uphill these days because there has been such challenges. And the nice thing about it, to me, about the federal law is that they have the U.S. Food and Drug Administration has such strong power, probably the strongest power of any regulatory agency in the world over tobacco products versus any other country. So and it's a lot easier, as you know, to regulate the dozens of tobacco, the major cigarette manufacturers or major e-cigarette manufacturers. I know there's lots of little ones, but the dozens of those versus 300,000 to 400,000 retailers versus 20, 30, 40 million users of the product. So even given some of these challenges, that's one of the reasons why I'm really excited about if FDA can get these policies in place, I think that minimizes, that will help address some of these issues.
I just want to say one thing about the preemption issue, because we deal with this all over the country, these preemption laws and these preemption battles. And of course, the Public Health Law Center is just a remarkable resource for people who are fighting those laws. But, you know, we were trying to come up with a way to sort of make it parent friendly, to get parents worked up about preemption laws for tobacco. What does that really mean? And so to respond to the questioner's comment about the political climate, what we've basically in those local fights and the preemption fights are telling people, like, the issue is, I live in a community and I know where my kids are getting these products. Don't tell me that I don't know what's happening in my kids' school and in my community. And so really encourage people to frame it, you know, not in terms of any kind of political battle, other than my family and our community, we know what we need to protect our kids. We think that that's been helpful in some of those fights with preemption, because the industry, obviously, that's one of the tactics, right, is these preemption fights, so that the laws that we all know and need in our communities aren't able to get passed.
Thanks, Meredith. And thank all of you. Thank you for those of you who responded to Kurt's request for additional case study topics. That's very helpful. I'm sure he'll follow up with you about that. And I want to thank all of our presenters and all of you for attending our webinar today.